And welcome back to the show, everybody. From the Hoag Orthopedic Institute, we have Dr. Koressel here with us. He specializes in adult hip and knee replacement, correct?
That's correct.
Doctor, welcome to the show. It's nice to have you here.
Yeah, thank you for having me.
We need you here. We need your expertise here in Laguna Woods Village. So we're going to get a little bit about your background. Tell us about your history.
All right.
So why did you choose to specialize in hip and knee replacement?
Yeah, so I grew up here in Southern California, up in Ventura County, and then I went up to UC Davis for my undergraduate training. Then moved back to the East Coast, where I was there for about 10 years. I did my medical school at Cornell, and then my residency at the University of Pennsylvania. Back to the West Coast for my fellowship training in adult reconstruction up at Stanford, and then back down here to work at Hoag as an adult reconstruction specialist. So I do hip and knee replacement. And for me personally, I think this is one of the most interesting specialties in medicine, because I'm able to take someone that's severely debilitated from either fracture, arthritis, or other injury and restore their function, allow them to walk without pain or minimal pain, whereas before they weren't able to walk or were bedbound or unable to go about their activities of daily living without chronic pain.
Now, doctor, is that something that happens because of an injury, or is that something that over time the ability for the mobility decreases, or is it a little bit of both?
Yeah, so excellent question. There's a lot of different reasons for this to happen. Injury is very common. Some people may have fractures around the knee or the hip that require it to either be repaired or replaced. A lot of people develop arthritis over time, and there are several factors that can cause arthritis to happen. Age, genetics, wear and tear. Some people can have inflammatory arthritis, so in people with rheumatoid arthritis or other kinds of autoimmune disorders, this can attack the joints. And there's a lot of different reasons for somebody to develop joint pain and the inability to ambulate, and we have a lot of options for people to regain that ability to walk with minimal pain.
That's wow. I mean, what a joy that must bring to you to be able to take somebody who is in that position, who, their whole life is ahead of them. We live in an area where their focus is on sports.
Right.
And, to be able to play pickleball one day and the next day not. I mean, so what would you say to that? How would you advise people to avoid injuries to begin with?
Yeah, so I think it depends on why the injury occurred. And I think when you're looking at things like pickleball, that's something you would expect to play in your older years and be able to. If you're not able to do that, then something is clearly wrong with your musculoskeletal system. And so I think it's important to avoid injury, but also recognize when the injury does require some form of intervention. And
how do they know?
So I would say listen to your body. And so if you're starting to develop some pain while you're playing pickleball, for example, and it's continuing to increase throughout the day, I would say listen to your body, and you should probably take a break. It'll probably go away. If you can take something like an anti-inflammatory medication like ibuprofen or naproxen, then that can help with the pain. But sometimes it doesn't go away.
Yeah, sometimes you don't want to mask it either, right?
Yeah, that's correct.
Because if it's a true injury, you're going to want to address it.
So most of the time, it'll probably go away on its own. But if it doesn't, there might be a true underlying injury. Or you may have arthritis that you didn't know you had. Most people with arthritis have had it for years. Then they finally go in to see a specialist or their primary care physician, get an x-ray, they find they have arthritis. The arthritis didn't start when they started playing pickleball and developing pain. That has been there for several years, typically. And depending on the symptoms, there are several different interventions we can do, from non-operative management all the way up to surgery.
Wow. Well, that's good to know. Is there something about the Hoag Orthopedic Institute that really sets it apart from other surgery centers or other hospitals? Because, it's got a pretty prestigious name.
Yeah, so
What's it doing differently?
I definitely have a privilege of being able to work there because most hospitals are not like the Hoag Orthopedic Institute. Most hospitals have patients of all sorts intermingled. And so the nursing staff and the perioperative staff in the hospital aren't necessarily trained on specific musculoskeletal conditions. At Hoag Orthopedic Institute, we focus on only orthopedic problems. So everyone you meet, from the reception desk to the nurses to the perioperative staff, everyone is focused on musculoskeletal issues and helping you regain your function, helping you walk within 1 to 2 hours after a knee surgery or a hip surgery. So it's a different experience when you're at the Hoag Orthopedic Institute.
It really sounds like, they're putting health in front of medicine.
I would say that's correct, yes.
Yeah. And you're specializing in knee and hip replacement, but you have other doctors on staff who cover all the other areas of the body, right?
Yeah, so my practice is hip and knee replacement, revisions of hip and knee replacement, and general orthopedics, including fractures. But within my group, we have people that do shoulder replacement, elbow surgery, hand surgery, spine injections. We cover everything in the musculoskeletal system. And so if you come to see one of us for a musculoskeletal problem, even if I might not be able to do that specific surgery, I'll know someone that can. Mm-hmm. And we'll be able to direct you anywhere that'll be able to help you get better and regain your function.
Right. And tell our viewers, where are you located? I know there's multiple different centers of Hoag. Where exactly are you located? Yeah,
so I see patients in Irvine, so at Hoag Irvine, and up in Orange off of Main Street. And those are my 2 office locations. But within my group, we have several different offices throughout South Orange County as well.
Mm-hmm. Did you always know that you wanted to work at Hoag? Even as a med student?
Maybe not as a med student, maybe not that far back. But over the past several years, it's been someplace that I had dreamed of potentially being able to work at.
Yeah, like you said, what a privilege.
Yeah, correct.
A great establishment. So let's circle back now. I want to give our viewers some tips and pointers. What can they do so that, and I'm sorry to say this, so that they never have to come see you? We want to prevent these injuries. We probably can't prevent arthritis, or maybe we can, but what are some tips and pointers that you can give them? Yeah,
so arthritis, unfortunately, can't prevent that. Once you have it, you have it.
Really?
However, there can be things you can do to prevent the exacerbations of arthritis. And I think that's where you can extend the longevity of your joint before you need a joint replacement surgery. So if you start having knee pain about 20 minutes into pickleball, it might be time to take a rest. You don't want to push through your injury. You can exacerbate the problem, and then your recovery is going to take much longer. Mm-hmm. And if you start having pain that doesn't go away, see your doctor. There are several things we could do before joint replacement surgery, including medications, injections, bracing. We don't start at joint replacement surgery. Joint replacement surgery is where we end up when the non-operative measures stop working.
Right. Would you recommend activities such as yoga or stretching before or after playing these sports as well?
Absolutely. I think it's very important to stretch beforehand. Make sure your body is able to handle that physical activity that you're about to do, and it'll help prevent injury during those activities.
Mm-hmm. Wonderful. Anything else you'd like our viewers to know about you?
Yeah, so I'm happy to see anyone with an orthopedic problem. I may be able to help you both non-operatively and operatively. So I do injections in the office. I can help you find the right brace if you need it. I can recommend medications for pain relief. And if those measures fail, I can do your joint replacement surgery. And if you have another problem, say it's in the spine, in the hand, in the ankle, in the shoulder, I can also help guide your care.
Wonderful. Well, that's a vast amount of information, and we really appreciate you being here and sharing that with us, Doctor.
Yeah, thank you for having me.
Thank you for coming. You're watching This Day on Village TV. We'll be back after these messages.